Welcome to Nava Podcast with Leah Continence and Stella Pashos.
Let's explore the true essence of Nava.
Nava embodies the concept of beauty in all its forms. It represents the inner radiance that each woman possesses and the unique qualities that make her truly remarkable.
Our mission is to share the stories of inspiring women who are making their mark in the areas of fashion, health, lifestyle, and family. Our aim is to curate meaningful conversations where the journeys and experiences of our guests can inspire you in your own life.
We started this podcast to create a space where everyone can feel beautiful, inspired, and empowered.
Nava is not just a podcast, it's a celebration of the incredible women who have shaped our lives and the countless others who are yet to share their stories.
We can't wait for you to join us.
All right, here we are at the last episode of our motherhood series.
Yes, how exciting. How have you been?
I've been really good. We just got back from another Sydney trip, so it's been busy with travel, which is really, really good. I feel like I've manifested this.
And which hotel did you pick this time?
Oh yeah, good one. So as you guys may be on board by now, I am on the hunt for like my go-to Sydney hotel because I'm going every 3 weeks. So I think Crown wins at this point. But for this stay, I booked Oxford House in Paddington. I feel like Paddington is like just really cool. All the like nice boutiques are there. My favourite jeweller is there. I didn't get a chance to pop in, Natasha Schweitzer. But yeah, really cool area. Gorgeous wine bars and restaurants.
Oh, so nice.
Yeah.
And Louis has come with you a few times on these trips. What is his take on the hotels?
Yeah, look, Louis is not a fan of Crown. He's much more like a nature's guy, likes a bit of personality in a hotel. So I think Oxford House was good. I don't think we're there yet. My personal favourite is I think Paramount House is really cool. There's a bakery on the rooftop called AP Bakehouse, I think.
Cute.
Any Sydney-siders would appreciate. But yeah, overall a really, really fun trip. It was like 6 nights in total, and the goal was to run the city to surf. So we did it, 14 kilometres. It's a beautiful way to see the city. Takes you kind of through all the scenic routes through Double Bay, Rose Bay, and then you end up at Bondi Beach. So we went for a nice swim after.
Beautiful.
Yeah.
And did you find it really tough or easier than you expected?
I did find it hard. There's a lot of hills in the route, so I wasn't prepared for those. I had kind of not really trained for this much, so I didn't put too much pressure on myself. I did it in like an hour 35.
That's still so good.
Yes, but when reflecting on the incredible guest that we're about to have, I asked about her running efforts, and she advised that she clocked a half marathon in like an hour 29. But everyone has their own kind of, threshold for themselves. Respect.
We only compete with ourselves.
That's right. How are you?
Well,
Big exhale.
struggling to breathe. I am going to have Florence in less than a week. So super excited. Finally packed my bags. I'm on mat leave. I've given myself 10 days of leave. So finished work and just been having fun, finishing off the little bits and pieces. But I am watching Emily in Paris season 4. That is my go-to at the moment. It is so good. So
Love
I think
it.
you need to catch up on the
Yeah,
previous
I'm
seasons.
like I only watched season 1. I have like really short attention span with Netflix shows, so I'm gonna give it a go.
Yes. So we spoke to Rachel from Fitt Physiotherapy in this episode. She just has so much knowledge, and we talked all things pelvic floor. For me, the main takeaway was that you can control and train your bladder. I thought that was really interesting, and she gave so many helpful tips.
Yeah, that was super interesting. And I remember asking for a girlfriend about like incontinence and all the things, so we'll dive into it into the episode, but really helpful advice from Rach. And for me, it was about, I feel like she's just like a wealth of knowledge. It's all really, really good information. But even just like we had a short discussion around like pelvic floor and the role it plays in conceiving. So I think that might be like an area that's kind of overlooked as well.
Yeah.
Before we go, I have to tell you guys about my qualm of the week. I asked Lee if we could just do this, but we said we're going to be positive. Last week was good. This week, the qualm is, I've got multiple qualms traveling lately, but this guy got kicked off the plane, right? Because it like was this whole debacle because he wanted his luggage above his seat. I know we can't like get what we want in life, but I agree. Like, I've paid to be at number 2 so that I could get off, right? And I hate waiting to board a plane. So I've paid extra to sit at the front. I've now boarded last. So my luggage is now at 15.
Yeah.
So I have to wait for everyone to get off the plane before I can access my luggage because it's at seat 15. So this guy got kicked off because he was kind of like, I want my luggage, like it has my medications in it. Can we please put it, above my seat? And he, like the air hostess was not having it. I think he was a little bit rude in his delivery.
Isn't it meant to be above your seat?
No, it's like first on. Like I think that's the idea, but it's like first on, best dressed.
How annoying. So someone took up too much luggage space.
Yeah. And
I feel for the guy.
I feel for him too. And then the second qualm is like when you've checked luggage in and then you're waiting to pick it up and there's like always that one person like right at the front, like a race. And it's like if we all stand back, we can see our luggage clearer. We're all going to get it. We're all going to go home.
Oh.
Anyway.
The pleasures of transit.
Did you have any qualms?
Qualms is baby squishing all my organs and I can't breathe. I sound like a bulldog right now.
You're doing amazing, sweetie.
Thank you.
Rachel is a Melbourne-based pelvic floor and continence physiotherapist who is passionate about empowering women throughout their lifespan. With a background in exercise and sports science, Rachel transitioned into physiotherapy and developed a strong passion for women's health and pelvic floor dysfunction. And we're so lucky in this episode, we've got Rachel joining us. Welcome, Rachel.
Thank you. Hello. Thanks for having me.
We are so excited to dive in all things pelvic floor and talking about your new little baby. But before we jump into that, let's do our 90 seconds with. Are you ready?
Sounds good. Let's go.
What's the most surprising thing about becoming a mum?
I think probably how much your world changes, but how much they feel part of your world for like ever type thing.
Aww.
If that makes sense. Yeah.
Yes. So cute. What's your favorite way to relax when you're having a moment to yourself?
At the moment, it's reading a book on a Kindle.
Oh, nice. What are you reading at the moment?
A bit of a mixture. Like my husband just bought me a Kindle, so I'm like reading all these random books that I don't usually like kind of read. So I've just read The Secret American Wife, something like that, and it's about the war, about the Nazis and things, and it's really good. I'm hooked.
Oh, nice. I think I'm going to need to get a Kindle for when I'm on mat leave.
Definitely do it. I feel like it'd be great for the night feeds, actually.
Yeah. What's your go-to family dinner?
Pizza.
Yeah. Homemade or bought?
A bit of both. Sometimes out for dinner. Depends how time poor we are.
How do you handle mum guilt?
I probably don't handle it very well, if I have to be honest. It's a tough one. I feel like you're constantly learning and growing, and it's definitely something I need to work on in the very near future. Yeah.
Yes, it's very hard at the beginning, especially. What's the one thing you never leave the house without?
The nappy bag. Hopefully he's already packed.
What's one lesson you hope to teach your children?
I think just to be kind to everyone. You just never know what someone else is going through, regardless of how they kind of present to you in terms of their actions. And yeah, that's probably a big one. I feel like I'm learning that like more and more, particularly with like having staff and the business at the moment as well. So yeah, I think that's something that maybe we feel a little bit more sheltered from as we grow up, but as adults you really see that people are all having their own like battles, I guess.
So true. So true. How do you manage sleepless nights at the moment?
We are like super lucky since Izzy has turned 1. She's 15 months now. We have not had any sleep dramas at nighttime, but before that it was horrendous. So I feel like sleep deprivation is like its own form of torture. We would like tag team. We kind of would camp out in her room after midnight to try and get some sleep rather than sneaking out of there. It was just chaos a lot of the time, life at that point.
Oh, it is the toughest time, and you just don't know until you go through it. It's
No, I feel like it's nothing you could ever prepare for. Hey, you just like don't know what it's going to be like.
What's the most ridiculous thing you've done because of mum brain, or forgotten for that matter?
I don't even know. Probably, I probably forgot it. I actually have no idea. I feel like I do ridiculous things all the time. Like the thing that stumps me every day is just like having a normal work conversation with a patient, and it's like your brain just goes another direction, your mouth goes another way, and you say different words to what you mean. So that happens to me on the regular now.
Do you have any stories, Leah?
Oh, well, I just had my baby sprinkle on the weekend, and my best friend, who I've been friends with for so many years, I completely forgot her child's name. Like it was
I was there for this
crickets.
live. It was good.
I don't even know if I knew my name at that point. And it just, I felt so bad. Actually started crying.
Oh no, the hormone
felt-
thing. I thought you were going to say you forgot your best friend's name. I was like, oh gosh. I feel like that could happen though.
That probably would have been better than her child's, but all right, last one. Did you have any food cravings during pregnancy?
No, like cravings or aversions really for me. I mean, I kind of like had saladas when I wasn't feeling well, which I feel like was a kind of dry bicky we grew up with, and a couple of glasses of orange juice here and there, but nothing like major that I felt like I had to leave the home and like track it down for, I guess.
Yeah. No, me neither. I think like those foods that I'd like feel like eating, but not like that I would die if I didn't eat it.
Yeah, it's like so hard to imagine what that must feel like though. But
All right, that's a wrap. Thank you so much, Rachel.
Can you share with us a little bit about yourself and what you do?
Yeah, absolutely. So my name's Rachel. I'm a pelvic floor and continence physiotherapist. I own a small business here in Melbourne, which is based in Mount Waverley, called Fit Physiotherapy, and we specialise in the pelvic floor and women's health. Outside of that, I have a 15-month-old daughter, Isabel, and I suppose I feel like since having her, your whole world kind of starts to revolve around being a mum, that you do kind of, when you get these questions, forget like how to answer them about yourself. So I guess like outside of that though, like I have previously, like running has always been a really big part of my life. Unfortunately, it's something that is like a real struggle for me, like since having Izzy, to make it a priority, and also just to get back into it with like my body after pregnancy, which is kind of disappointing because I feel like that really defined me before being pregnant, and probably like a lot before COVID as well, and before the business started ramping up. That was kind of always who I was. So I guess like, I don't know, I feel like my life is like business and motherhood at the moment. I love going to the beach, spending time with my family. We have a fur baby, Charlie. He's a golden retriever. He takes up a lot of our time as well. But outside of that, I don't think I really do a lot else. So pretty boring but chaotic all at once.
I don't think boring at all. It sounds like a lot on your plate. But definitely what you were saying about, I guess, that shift in your identity coming from running being such a big part of your life to now having all these other different hats you have to wear, and that having to go to the side a little bit is so common. And finding your new identity and how you balance all those different aspects is definitely a challenge that lots of women face during this postpartum time.
Yeah, I agree. It's really hard to find those times for you. And like, I think that probably me, and like I'm sure a lot of other people go through this as well, is that you feel like the time that you could put into yourself and like get back to you don't want to miss out on like the family time. And I feel like the time for me is always like on a weekend, or like I would miss out on family time if I did that. And it's like just really hard to find that balance. I don't know if you found that too.
Yeah, there comes mum guilt again.
Yeah, mum guilt. Yeah, that's a good way to describe it. Always there.
I guess it would also be there, like, especially having a business, you would be like, before Izzy, you'd be like, oh, anytime I have, like, maybe I'll put that into the business. And then you have a baby and it's like, okay, I'm going to put that into the baby. And it's like,
Absolutely.
yeah.
Absolutely.
can you share with us, like, what's the extent of this running hobby that you have?
Yeah, I mean, like, I guess, like, growing up, I always, like, did athletics and middle distance was kind of my thing. I ran, like, at a, like, kind of state and national level for a few years throughout high school, and then as I kind of got out of high school, I think I kind of went through, like, more of a social phase and kind of stepped away from competing and then came back to it probably in the few years before COVID, and was doing like half marathons and things that were a little bit longer, but more for the social aspect rather than anything else. But it did take up a lot of my time back then. And then unfortunately, when I was pregnant, I had really bad pelvic girdle pain, and it presented really acutely with a run when I was maybe like 11 weeks. And it kind of knocked me out of a lot of exercise for the whole pregnancy. And then just like postnatally, it's like hung around for just over a year. So it's only kind of just resolved in the last few months. So I feel like I'm not even a runner anymore, but I still call myself one.
Get back into it. Can you please inspire me with your half marathon time? I've done one half marathon. I did the Melbourne Marathon last year, but I'd love for you to inspire me with your time, please.
My best was a 1 hour 29. And I think I crawled the last like 4K and vomited my way through the MCG. So
that is incredible. Oh my, okay, just for anyone's reference, it took me like 2 hours and 40 minutes.
That's amazing though. That's amazing.
And I was just blaming it on the bathroom. I was like, there was a 30-minute bathroom stop. Okay. The line was long.
I missed out on a qualifying time for this like little kind of like more elite part of my training group at the time, and I was shattered. So but anyway.
Yeah, well, hats off to you for like, that's an incredible effort. Yeah,
that is so fast.
It's just making the finish line, I feel like. So
yeah. Tell us about Fit Physio and what inspired you to start your own little business.
Yeah, I think like in terms of starting the business, I kind of fell into it a little bit. I was working at a musculoskeletal clinic in Mount Waverley as like my first job out of uni from graduating from a physio degree. And I started my women's health training while I was there. I met some doctors that were very local to the Waverley private hospital. And they were building a new building right next door to the hospital at the time when I met them. And were going to form this kind of business, which is now Create Health, which is quite big out in the southeast suburbs. And they wanted a physio to come and use one of their rooms. And so I kind of just took the opportunity and started working like a half day a week there, and just over the years gradually built it up. So that was probably maybe 6 or so years ago now, I think. And then kind of just worked like in a private practice separate to that, and also went through the public system as a continence physio and women's health physio out at the Anglis part of Eastern Health, and then just slowly kind of moved into like more of a full-time space as a sole trader, I suppose. Once I was consulting full time and had a real passion for the field of like pelvic floor and women's health, and knew it was something I wanted to continue, I started looking for my own space. And it probably wasn't long after that I found out I was pregnant with Izzy and needed to have staff come on board to help cover my caseload. And that's like how Fit Physio was kind of born. I was always like trading under Rachel Fitt Physiotherapy, and we rebranded once I went on maternity leave to, I suppose, allow the staff to create their own identities, and for me to have my own personal identity as a practitioner as well as the business side of things. So that's how it kind of came about. And I don't know what I would do if I wasn't doing that right now. I don't think I would work as a physio in any other field other than this. I think I would be lost if I didn't have the business. So that's kind of how it came apart or about.
That's so cool. Could you explain what pelvic floor dysfunction is and what it is to be a women's health physio? Because I don't think a lot of people actually know.
Yeah, the extent of it. I suppose like in terms of pelvic floor dysfunction, like a dysfunction always means when something's maybe not quite working as well as it should, and there's maybe some kind of like abnormal I suppose, degree of movement or function or whatever that may be. In this, like, I suppose, instance, we're talking about the pelvic floor specifically. So maybe I'll start with like what the pelvic floor is and then kind of run you through what a dysfunction of that might look like. But the pelvis is, if you think about like your bony pelvis, like you have your pubic bone at the front, your tailbone kind of at the back down a little bit lower, and then your sit bones underneath. And your pelvic floor makes up the floor of that pelvis. So your pelvis is kind of like, imagine it like a bowl, and then your pelvic floor is the base of it. And so the pelvic floor is made up of nerves, blood vessels, ligaments, and connective tissue. And I suppose when people are talking about the pelvic floor, they usually are probably referring to the muscle aspect, because that is something that we have quite heavily focus on, because we can change and improve its function, like other muscles in our body, by doing exercises. But the connective tissue can also result in quite a bit of dysfunction as well when we speak about that aspect. From a muscle perspective, I suppose if we're talking about normal function, like other muscles in your body, you should be able to use the muscle over a full range of motion, meaning that you have a really good contraction, but you also have a really good relaxation, and your muscle is able to operate within its full range. A type of dysfunction can start to come about if your muscles don't operate throughout the full range of motion. And so for some people, that could look like a weakness where they're not able to get a full contraction. And for other people, it might be like an overactivity or tightness, and they're not able to get a full relaxation. And when you have one of those things occurring with the muscles, you can start to experience symptoms of dysfunction, which might be like urinary incontinence. It could be like a vaginal heaviness or a dragging or a bulging, dislodged tampon feeling, indicating that there could be like a prolapse where the organs can slip and fall down into the vaginal space. And the connective tissue weakness can cause that as well. Things like constipation can happen if your pelvic floor is too switched on and not relaxing properly. You can have sexual pain. You can have pain, like pelvic pain below your belly button as a symptom as well. So they're probably some of the most common ones. And then there are like bladder urgency, where you feel like you got to rush to the toilet. And the same can happen with the bowels, as well as the incontinence from a fecal component. You were asking as well, like what we do in that space. I guess like probably the most unique thing about like a pelvic floor physiotherapist is, because the pelvic floor is internal, the best way for us to like be able to accurately assess, diagnose, and treat pelvic floor or pelvic floor dysfunction is to be able to do either vaginal or rectal examinations. And to do those, we would use one or two fingers to be able to digitally access the area and be able to give relevant information to the individual.
Yeah, and it's so important, I think, throughout a woman's life to, at some stage, get assessed and see what is going on, or just how healthy it is, like any other muscle. And I think it's not often a spoken about topic. I think that's one things I always tell my girlfriends if they're having a baby: make sure you book in to see the women's health physio. I think our previous generation probably didn't do that as much, and it's like, okay, I've had a baby, like, so obviously this is about motherhood. It's just normal to have to rush to go to the bathroom, like as soon as you have the urge to go, but it doesn't have to be that way. It's just like a muscle that needs to be exercised and strengthened and checked. Like if you had a torn hamstring or something like that, you would go to the doctor.
Literally, exactly. And that's the thing with like particularly like birth injuries associated with vaginal births and recovery. It's like when you compare it to like a torn hamstring or an ankle sprain or any other kind of injury in your body, usually you rest, you sleep, you have good nutrition, you do all these things to kind of look after it. But when you have a baby, like you're doing none of those things. And sometimes like dysfunction can be lingering in the background, even if you're not symptomatic of it straight away. And it can really come up as you start doing your everyday things a couple of months later and you start pushing your body a little bit more. But I think that's just the reality of being a mum, isn't it? You just like straight away, it doesn't matter how bad you feel, you're just bottom of the list. I don't know. It's like, it's so bad, but we need to look after ourselves more.
Yeah, definitely. I think such helpful tips just to be aware of and bring it front of mind as well. Add that to the list of things. I was talking to my girlfriend today and I was letting her know that we're catching up with you, and she was like, I just wish like it was part of the like baby starter kit, postpartum care. And, you know, she was saying that one thing she actually had a huge fear of after she gave birth to her son was like bowel movements.
Mm.
Do you have any advice for women that have just gone through a pregnancy and like that fear of whether it's passing urine or bowel movement?
Yeah, I think it's I mean, like, it's such a delicate and sensitive area at the best of times, isn't it? So when you go through an experience like a vaginal birth in particular, there can be like a lot of nervousness and fear associated with going to the toilet. Probably like our best advice that we give patients is like you want to beat constipation and like really prevent it. So like making sure you have stool softeners and that you're drinking heaps of water right from the very start can be really important. The research would actually show that going to the toilet to urinate is probably going to elicit more pain than doing a poo. So don't worry too much about the poo. If you get your wee out of the way, you probably won't think about it as much anyway. A poo should hopefully be no dramas. But also just like usually in the hospital, in the maternity wards, they have little step stools, like putting your feet flat on a step stool. So your knees are higher than your hip and leaning forward, allowing your tummy to relax can like assist you to go to the toilet as well. And if you do have like any perineal injury, wrapping your hand in toilet paper and just supporting the area can also help with just the pressure that the toilet bowl creates too. So yeah, it's probably the biggest thing is just avoiding the constipation though. From a bladder perspective, like weeing in the shower for the first time can be helpful, or kind of spraying some water over the urethra at the same time, but just trying to prevent your urine being really concentrated when it's really yellow. You just want to keep your fluids up so that it's diluted all the time, so it's not acidic really.
Super helpful tips, I'm sure. What about, I imagine like you would have a need. So we're getting into it now, guys. What about the need to like push for a bowel movement after, when I imagine it's all like, you know, some people will have stitches, and how do you avoid that need for the push? Is that where the stool softeners come in?
Yeah, pretty much. So like even to protect the pelvic floor and the connective tissue that's supporting the organs, like we don't really like, I suppose normal bowel actions, or what we would expect people to go to the toilet, is like a soft form stool and it be no effort, so effortless to empty. So usually anything requiring like a bit of effort would indicate that you could probably do something to help you. So deep breathing and kind of letting your belly flop could be one of them. The stool is another, and making sure the poo's not too hard. If you're like sitting on the toilet and nothing's like happening and you're feeling like you need to push or you're straining, you're almost better to like get up, leave it, take some stool softeners or like lactulo, something like that, to like get things moving, and then go back to the toilet the next time you have an urge. And I guess with the bladder you can delay, and it's totally fine to ignore your bladder urge for long periods of time and just keep delaying that. But with your bowels, if you ignore the urge to go, sometimes you lose the urge altogether and you might not get another urge to like the next day, which if we're trying to prevent constipation isn't great either. So it's like one of those things in the early days postpartum, you really just want to listen to your body, and if you get any kind of like signal that you need to go and do a poo, you're better off to just go and do it and give yourself the time you need without straining.
All the things, real talk.
Real talk.
Yeah. I feel like I talk about poo all day long, like at work, at home with Izzy.
Yeah. Second language.
Yeah, this is great.
What are some of the common misconceptions about pelvic floor health that you encounter?
I think probably there's probably a few that like pain or discomfort with sex to some degree would be normal. So like no pain or discomfort would be normal from that aspect. And the pelvic floor tightness or overactivity can contribute quite heavily to that. Another one is that like leakage after having a baby is relatively normal. And I think it's like great that like a lot of people are talking about bladder leakage a lot more on podcasts, social media, things like that. But we do have to be like so careful with the language we use around it, because saying that it's like normal and, you know, joking about having it isn't like what we want to get across to the public. We want them to know that it's really common, but you can do something about it if it does bother you, and you don't have to live with that symptom. So that's the other one. And then that strengthening the pelvic floor is something that pregnant women need to do. So most like people that we would assess in clinic during a pregnancy often often need to work on the relaxation aspect and getting like full range of motion to relax the pelvic floor, which has many benefits from a vaginal birth and pushing phase perspective. So not everyone needs to do the strengthening. And I guess that's really hard when people can't go and get an individualized assessment, and it's not accessible for everyone to come and see private physios in the community for these assessments. So if you're one of those people and you don't have access to like someone to do an internal vaginal examination to tell you what your pelvic floor is doing, then making sure you really concentrate on the relaxation aspect is so important for the function of the pelvic floor, but also for preparing for delivery.
Yeah, that's so true. I after my birth with my first, I had to learn to relax and have that full range of motion. That was one of the things I had to focus on more than anything, which I didn't know about. I just thought it was all about keeping it all tight.
Absolutely. And like we probably grew up in a generation as well where like maybe the pelvic floor was starting to get spoken of a little bit more, but it was always kind of like tighten your pelvic floor, do your Kegels, or like suck your tummy in a lot, and then your pelvic floor switches on with that too. So for a lot of people, it's kind of like undoing years of like, I suppose, poor habits associated with holding tension through their pelvic floor. And it's the total opposite. Like it's always like one of those sometimes like mind-blowing things to tell patients in the clinic, because it's like usually the total opposite of what people come in and like expect to hear from us. Like at the end, they're like, oh yeah, that makes sense. Like I am very tight and can't relax my body anywhere. So
So my girlfriend's going to kill me for sharing this, but not the same one, if anyone's wondering. It's anonymous. We went out one night and we had a few drinks, and then she experienced some bladder leakage. And we went to the bathroom and like tried to dry it over the hand dryer. But I just felt for her because we was like a night out, we're having fun. Like, you know, it's hard to get out as a mum as it is. And then you put in the effort to look gorge, and then you experience something like that. What are some of the things, like if it's not actually that normal, as in we shouldn't just leave that unattended, what are some of the things that she could be doing, or women in a similar scenario could be doing?
Yeah, I think probably like first of all, kind of knowing exactly what the trigger is for your leakage. And some people that are experiencing leakage don't always like know what the trigger is unless they really kind of track it and try to find a pattern. So for some people, it can be like a stress incontinence. So on a mum's night out, it could be like having a boogie on the dance floor and the dancing like triggering a bit of a leakage. Or it could be like a bit of an urge incontinence where you can start to get like a sudden urgency to go to the toilet, and the bladder actually starts emptying either on your way there or without warning. And on like a night out, like you were talking about, alcohol can be an irritant to the bladder if you're drinking, and it actually can contribute and cause that type of leakage as well for some people. So I guess like kind of knowing like, do you have any like fluid or dietary triggers? Like, is your leakage associated with like more of an urgency and needing to go to the toilet? Or is it more of a stress incontinence where it's induced by a movement or an activity? Because the treatment for those things can be very different. The leakage associated with an urgency and on the way to the toilet, a lot of the time it can be like you not having very good control over your bladder, and your bladder actually kind of controlling you. So it's almost like we need to get this brain control to start teaching the bladder that it's not okay to just empty like that. And some things that can help that are just like making sure you avoid just in case wheeze, because just in case wheeze teach the bladder to empty with smaller volumes, and it kind of starts to learn that that's normal. And then if you have something that irritates the bladder, it's like, oh, this is like near our normal capacity when we kind of usually go to the toilet. Let's just start emptying it. The other thing that can trigger it is drinking like high volumes of fluid in short spaces of time. So the quicker you drink a heap of fluid, the quicker your bladder will stretch and full, and sometimes it can get irritated by that and cause an urgency and leakage. So spacing fluids out, drinking plenty of water always will help kind of dilute the concentration of any irritants in the bladder, and just trying to have good bladder habits and only going to the toilet when you feel like you need to go, which would be a normal full bladder sensation is felt in the lower tummy, usually a sensation that you you feel around the urethra is what we call like a bit of a false urge or an irritation. And that can be something that we can retrain in clinic. And then I suppose the flip side of it, the leakage associated with a movement or a activity, often that's some type of pelvic floor dysfunction. And there are small muscles around the urethra that can contribute, like a weakness of that can contribute to that type of leakage. And a good way to test if that's something that would be impacting you is to try stopping the flow of wee on the toilet. If you feel like you can't fully stop it or you can only slow it, you could intermittently practice some pelvic floor exercises by flow stopping. Previously, like if you looked online, you might see that there is a lot of advice saying you shouldn't do that, but we are getting more research saying it's totally safe to flow stop on the toilet intermittently for pelvic floor exercises. I wouldn't do it every week, but 1 or 2 times a day would be fine. And then like just general pelvic floor exercises, making sure you can fully contract your pelvic floor, fully relax, can hopefully start to address any other kind of mechanism of leakage associated. But this is where it gets really hard to just give generalized advice.
Yeah, of course.
There are so many different kind of mechanisms around it. So definitely talk to your GP though as like first point of call, and, you know, get referrals from there if you need.
Yeah, but that's just so good to know that all of those things are associated with our pelvic floor. Like I didn't really think about anything to do with the bladder and I guess if you want to call it creating a lazy bladder and
Yeah.
how much liquids you can hold and all those things. Like it's really like a muscle. Like how much can you lift?
Literally. And don't be afraid to delay the bladder. I think people think it's bad to hold on, but it's like totally not for your bladder. It's like bad to go more frequently. But I think like the thing, like particularly when we look at motherhood, is that in pregnancy, like you have your baby who is one, like extra weight on your bladder, but also something that moves. And your bladder is like so sensitive to pressure changes. So when you move, because you've got the extra weight on the bladder, you can feel like more of a heightened sensation of needing to go to the toilet. But when the baby moves as well, it creates the same feeling. And so a lot of people in pregnancy start to develop this really poor habit with their bladder where they're like, oh yeah, I need to go to the toilet again. And they just kind of keep going every time the baby moves or they move. But it's not, they're never letting their bladder like achieve like a full capacity. And then when you have your baby, because like you feed so often and your feeds go for so long, if you've developed those habits in pregnancy, often those people will empty their bladder before a feed and after a feed, and they'll do that like throughout the whole 24 hours. And so they're never kind of, that's now all of a sudden that bladder has like the control, and you start to get these like fake urges to go to the toilet because your brain no longer is controlling that. And it's like you just kind of need to get that confidence back that your bladder can definitely hold. And so a lot of it is like really behavioral retraining and like trying to break habits that have been associated with certain activities.
That's so interesting. Speaking of the pelvic floor being a muscle and all of that, this is a question for myself, can hyperemesis and that constant vomiting really affect that also?
Yeah. Oh, hyperemesis. I can't even imagine. Have you had that, Leah, this pregnancy?
Yes.
Oh, go you. You're doing. I wouldn't have even known. Like, go you. I like hats off to
Seriously.
anyone that has had that. The recurrent vomiting, so hyperemesis, any other type of like medical condition that would cause vomiting over excessive periods of time like that, and also eating disorders, if people are vomiting up food, with the vomit and the higher levels of intra-abdominal pressure, also pressure in your tummy pushing down on the pelvic floor. So the pelvic floor, if you remember, is the muscle, the connective tissue, the nerves and the blood vessels. So all those structures can like with the recurrent pressure being put on them can stretch and weaken. And so I guess our biggest concerns are, one, the muscles can weaken because of that. Muscles we can retrain though. So it's not, the end of the world if you have muscle weakness. It's something that we can work on. It's more the connective tissue we get more worried about. So the connective tissue, if you imagine that like a fishnet around the organs, in pregnancy anyway, you've got something heavy stretching the connective tissue. You've also got high estrogen levels that allow it to stretch more. Every time you vomit, or same if you've got a chronic cough in pregnancy, you're straining it even more. And then I suppose if you have a vaginal birth, that connective tissue has has to stretch to allow the baby to come through. And so the connective tissue can end up with quite a bit of weakness, sometimes some injury to it. And if it doesn't kind of bounce back or recoil really well after having your baby, it can allow the organ that it's supporting to sit lower, and it can cause a prolapse or contribute to someone having a pelvic organ prolapse, where the bladder, the uterus, or the rectum could sit lower into the vaginal space. Sometimes in the early postnatal period, those aren't permanent symptoms or anatomical presentations that we'll find on assessment. They can continue to resolve and improve as that connective tissue stiffens over the first 12 months postpartum. But for some people, they can be like permanent, and you have then a pelvic organ prolapse that could be quite bothersome and impact quality of life. So I guess it's a risk factor for those things. It doesn't mean you would have it, but it is definitely a risk factor. And the other one is constipation is a common one across the childbearing years as well, and straining on the toilet.
Yeah. And then with prolapse, that can't always be trained or healed with physio help, can it? It can involve surgery and a bit more invasive practices.
Yeah, there are like a lot of different treatment options. And like the first one is to do nothing. Like, so usually in like postnatal screenings or whenever someone presents for a pelvic floor consult, like we'll always screen the anatomy. And sometimes we'll pick these things up just because we've gone looking for it. So it's very common for us to find like what we call an anatomical prolapse, which would be where we're seeing it on the assessment, but you as a patient don't have any symptoms of it. And then some people will present with like clinical prolapse where they have symptoms of it and we're finding it on assessment as well. In the postnatal population, you don't have to do anything about it. It could continue to spontaneously heal and recover by itself. So from a genetic component, you know how some people get stretch marks, some don't, some get abdominal separation, some don't, some have prolapse, some don't. Can be like genetic in terms of the type of connective tissue you have and how well your body kind of recoils and stiffens after. And so some people have really good kind of spontaneous recovery over the first like 3 to 12 months after having a baby, and others it can be much slower, or they might not get as much spontaneous recovery. And so that can just depend on the type of connective tissue and the individual. Doing pelvic floor muscle exercises to like make sure your muscles are supporting the organs for your everyday stuff can be really helpful in reducing symptoms. But every time you do need to cough, sneeze, vomit, lift, bend, if you engage your muscles to kind of brace for that pressure, you'll help better support the organs while things are healing. And then we are getting more and more research and case studies kind of looking into pessaries for prolapse in the postnatal population. And a pessary is like a silicone device that can be inserted vaginally, and they come in different sizes and shapes. And the idea is to lift the organ up and take a little bit of pressure off the connective tissue to try and encourage more healing. So we know that pessaries outside of the postnatal population over a prolonged period of use, say 2 to 3 years, can improve the severity of the prolapse in terms of what we're seeing with the anatomy on assessment. But we're seeing more and more evidence that the postnatal population may have even better kind of healing and response to a pessary as well. So there are different treatment options, and it all depends on like the individual and what their circumstances are, how comfortable they feel, and kind of going from there. Definitely like avoiding your constipation and like making sure that if you're sick with like vomiting, sneezing, coughing, that if there's anything that you can take to suppress those things to take the pressure off the pelvic floor, particularly in the early stages postpartum, that can be really helpful just to allow things a better chance to recover, I suppose.
Wow, why don't they teach all this stuff in school?
I know. How good would it be if we learned this in school? But also, like, it's really like I was looking at some research this morning just about like birth education in pregnancy. And one study was showing that like just over 60% of people knew about this type of stuff in pregnancy, but only 20% of people heard about it from like a health professional or their care providers. The rest of them was like the internet, social media, or talking to family and friends, which is like amazing that like only 20% of people are hearing about this from like their obstetric care team. I feel like that's something that we'll probably see across the world change quite heavily in the next 10 is that education coming from the obstetric healthcare team, including the pelvic floor physios. But social media is just like so powerful for this area, but you don't really stumble across it unless you somehow fall into that algorithm, I guess. So it's, schools would be ideal though.
Speaking of Kegel exercises, I have a story. So I used to work in medical devices. So I was in operating theaters like for long hours, like in watching childbirths and plastic surgery, general surgery, all the things. And I had this one case I was in, and my colleague came along and she had this app, right? And we were standing there together and she would be like, she prepped me before we went in. She's like, we're in here for like 6 hours. So she's like, okay, I'm going to like signal you with my finger and be like she had this app she was following and it would say 3, 2, 1, squeeze. And she was
or something. Yeah.
Yeah. So she was doing Kegel exercises like the entire case because she's like, what else are we going to do here? So I was doing them. So can you talk to us about the effectiveness of the traditional Kegel exercise? Because I think when I think pelvic floor, and obviously now that you've explained it, it's so much more detailed than what we perceive it to be, hence that 20% that is aware of it in that birthing kind of period. But yeah, can you tell us like what is the Kegel exercise and what are some other exercises people could be doing?
Yeah, absolutely. So I suppose like the Kegel terminology comes from America, and that's kind of what they call pelvic floor exercises. So in Australia, we usually refer to it just as pelvic floor exercises, but same thing as Kegels. And I guess like kind of like when you're training other muscles in the body, there are different ways to train it. So you can train, generally our focus points for the pelvic floor are coordination, strength, and endurance. So from a coordination perspective, we're looking for kind of like rapid pace where you can turn the pelvic floor on and off very quickly, or contract the pelvic floor to respond for a cough, a sneeze, a lift, a bend, things like that. From a strengthening perspective, to strengthen your pelvic floor, you're generally looking to do 3 sets of the exercise with about 8 to 12 reps of a certain kind of period of hold. And generally for strength, if you're holding for longer than 10 seconds, you're probably starting to work at more of a submaximal level, and you're actually then looking at endurance. So for strengthening, you're kind of like 3 sets of 8 to 12 reps for no more than 10 seconds. You're really trying to work as hard as you possibly can if you're doing that. And then your endurance, you're kind of usually working at a submax level, about 60-ish% of whatever you feel like your max is. And you're kind of holding for longer than that, 10 seconds plus, usually, depending on where you start. Usually our aims are for about a minute. And so I guess when you think about training those different things, kind of like if you compare it to running, you might do some strengthening like 3 times a week. You might work on endurance 3 or 4 times a week, and you might do some coordination, work a few times a week as well. And so if you're wanting to work across all of those things, you might end up doing them all in the one session, but just do a little bit of each, or you might choose to separate them all and do them individually, or you might work on one thing at a time and every couple of months change your focus. And so I guess like you can end up doing a little bit of everything, but the easiest way to think about it is literally just how you would train any other part of your body. And those squeezy apps, like they can be really good for just ongoing maintenance, because a lot of the time they'll have preset programs that you can kind of follow, where it starts really easy, but it will gradually get harder as like, you know, the time goes on. But like your other muscles, if you work it too hard, you can, one, make it really tight, but you can also get like delayed onset of muscle soreness, where the area can just feel like really heavy and fatigued if you do too much at once. And it is like, it sounds like it when we're talking about it like a big muscle group, but it isn't. It's like such a tiny muscle group, but there's a lot going on in that area, but it can get really sore if you do too many exercises.
Speaking of exercises, I know with my first, I was like, I couldn't wait until someone told me you're good to go to exercise. So I want to feel like myself again. And there's always this 6-week rule. Talk to us about the 6-week rule, and maybe potentially like what are some things you could probably do within that 6 weeks if you really feel like you need to. And I guess then also how you can go back to exercise after the 6 weeks. So lots of questions in there.
Yeah, no, that's okay. I guess like the 6-week rule is just like, I think because that's when you have like your OB checkup and your GP checkup, it just kind of like falls into this, oh, you shouldn't be doing like anything before then, but then all of a sudden like you're good to do whatever you want. Like it doesn't really work like that in terms of how our bodies heal. When you think about what you're doing the day or the day of you get like giving birth or the day after, like functional movement, like you're lifting your baby up, you're sitting down on the toilet, you're getting in and out of bed, you're sitting down on a chair, like you're doing all these functional movements that we have like exercises for. So things like squats, deadlift technique, some arm work in terms of light dumbbell stuff. Those things are all like very like safe for you to start very early postpartum because you're doing it already anyway. And so I guess like an easy way to kind of like start with those types of exercises, like every time you stand off the chair or off the toilet or you get out of bed, you kind of like do it really specifically and like use your muscles to do it. And then you'll naturally start kind of like adding in maybe like you might do 5 sit to stands after like going to the toilet, or you start adding in some like light dumbbell work or some like core rehab or, some balance exercises. And so there is like so much that you can do early on. It's like so hard to sit here and just like tell everyone like what to do because everyone's circumstance is so different. Like you have to really listen to your body, but it's generally like safe to do sit to stands, which is like a modified squat, single leg balance in pregnancy, practicing like standing on one leg again so you don't like roll your ankle as you're like taking the pram out of the car or something. So, that is a form of exercise. You probably have abdominal separation where your 6-pack muscles are like separated a little bit more than normal. Starting some crunches for majority of people is really safe early on as well. Some lunges, some side lying Pilates glute activation. There's lots that you can do. So if you're like lost, you're probably best to like engage with a pelvic floor physio or a women's health physio. Don't be afraid to go and see someone like 1 week after birth if you're really eager to like move your body and get back into things, because there's heaps you can do. There are some like online programs that will state they're very safe to start from week 0 postpartum. In terms of like getting back into walking, postnatally, it's all about trying to rest your pelvic floor as much as possible to allow healing to occur. Unfortunately, the pelvic floor can only be rested when you lay down. So the more time you spend on your feet standing or the more time you spend sitting, there's always a constant pressure on the pelvic floor, meaning that it's not getting a rest and time to recoil. So from a walking perspective, we usually like encourage people to do 10 or 15 minutes up to twice a day. And then each week you're kind of starting to make your one walk a little bit longer. So you're generally at about 45 minutes by 6 weeks postpartum. But the walking restrictions probably come more from a place of we don't want you on your feet too much. And so if you're already doing your kind of household stuff with your baby, plus like having to go to appointments, you might duck out to the shops. If you then go for a long walk on top of that, you do end up spending a lot of time on your feet. So the walking restrictions are really just to kind of get people to rest more and not do too much on their feet. But anything else that you do inside lying is unlikely going to be to put enough pressure on your pelvic floor to do harm.
I feel like they're all really nice, like practical tips and exercises that anyone can do. Because I feel like that 6-weeklier that you said, like so many mothers would shy away from any form of physical activity in that period just to like play it safe. But even from a mental health perspective, like engaging in some sort of gentle exercise as a ritual for yourself would be really beneficial.
Absolutely. And then like 6 weeks, I guess like most Pilates studios will want some kind of clearance like at 6 or 12 weeks or like some medical clearance to go back. So generally like classes, getting back into the actual gym and doing things kind of where you're like purposely going somewhere to exercise and swimming, they're generally things 6 weeks on. And so I guess the first 6 weeks, you really want to prepare your body to go back to those things, because going straight back into a class like Reformer Pilates, it's going to be pretty hard if you maybe didn't do anything the last couple of weeks of pregnancy as well. And then in the early postnatal period, if you've done nothing, you're probably going to like really struggle when you first go back to the class, even if it's something you're used to. So keep like doing something at home just to kind of maintain and activate your muscles is going to be nice for returning, but also great for your mental health and to prevent some soreness from occurring throughout your body. So, sorry, I feel like I rambled heaps with like giving you exercise ideas for the first 6 weeks.
No,
I
I love it.
gets you thinking that you can definitely do stuff. Yeah.
No, that's really good. And you mentioned abdominal separation.
Yeah.
I know there is a technical term for it. I'm not going to say it now with my baby brain.
Diastasis recti.
That's
There it
the
is.
one.
I don't blame you though.
Can you explain to our listeners what that is and how they can get it back to what it was before?
Before, yeah. I guess like one thing is everyone has some type of abdominal separation. So if we think about the anatomy, your six-pack muscles run straight down kind of the midline of your tummy. They are separated by a small gap, which is tissue called the linea alba. So if you measure your abdominal separation before being pregnant for the first time, you'll have something. Like it's never going to be zero because there is tissue that separates it. So I think just like that's probably another myth that we didn't talk about earlier, is that like zero is the goal. It's like definitely not the goal. Something is normal. We just want to make sure that one, the area is functional, and two, it doesn't bother you. So when we talk about pregnancy, as your baby grows, your six-pack muscles will naturally stretch further apart to accommodate more room for your baby. So by 33 weeks in pregnancy, 100% of pregnant people will have abdominal separation that is more than a normal separation. And so generally like a normal separation at the moment is considered in most of the research about 2.2 centimeters. So more than 2.2 centimeters at 33 weeks in pregnancy is normal. And that will differ depending on the person, kind of where exactly they are at that point. Some people may start to experience what we call doming as well. And that's kind of where a TP type shape starts to occur right through the midline of the tummy, generally when pressure in the tummy increases. So if you did like a little bit of a crunch or a head lift, sometimes you might see this TP kind of triangular shape in the midline of your tummy. And that indicates that the tissue, that linea alba in between the six-pack muscles, is starting to weaken and you're no longer able to control intra-abdominal pressure, and the pressure is just like popping through the midline. So if you're seeing the doming in pregnancy, or even not so much postpartum, actually just pregnancy, then every time you see that, you potentially could be making it worse because you're constantly straining something that's already really struggling to work properly. So that's why kind of the whole rolling in and out of bed to protect your core and avoiding crunches, why those recommendations are there for pregnancy. But definitely if you're exercising a lot in pregnancy, particularly in the third trimester, you do need to keep an eye on your technique because things can change very quickly week to week in terms of how your core is functioning. Once you have your baby and your estrogen hormone drops down to be very low. So estrogen is what makes everything stretch a lot more in pregnancy. Once it's very low, things start to recoil and stiffen up. So in the first 48 hours after your baby is delivered, your uterus contracts back down quite significantly, but you also have significant recoil of your abdominal separation in the first 48 hours. So for a large percentage of people in that first 48 hours, it can be back within a normal range, which would be less than 2.2 centimeters. For others, it can stay more than 2.2 centimeters for some time. I suppose if it is like within a normal range, but you don't feel like it's your normal, there may still be recovery still to come to get back to where it was before. And there's a lot of recovery that occurs over the first 6 weeks and up to the first 3 months postpartum. Wearing something really tight over your tummy to kind of like bring things back together can be very, very helpful. So something like Tubi Grip is backed by research, which is like almost like a compression stocking that you can get for around your tummy, or something like a shapewear type garment. Postnatally, it can be quite tight and compressive. You just want to make sure that you can move as per normal and that you're not kind of block moving because something's stopping you from bending properly. And then crunches are great for improving the abdominal separation too. But as long as it's less than 2.2 centimeters, like your abdominals are working well, and it doesn't bother you, then you don't have to do anything about it at all. Obviously, if anything about it bothers you, then go and speak to someone, because we know that abdominal separation can create a lot of insecurities around body image, and there is a lot of research on that, and that is one reason to treat it if it does affect you from a body image perspective as well.
Yeah, postpartum, I loved wearing the recovery recommended by my physio, Rachel.
We're going to get them back out this time. How nice does it feel to like get something tight on the tummy though? I feel like your core just does not work like in those first like couple of days after having a baby.
No, it was amazing. And because I had a emergency cesarean, and I think it definitely helped, because then when I saw you at 6 weeks, I only had the typical 1 centimeter ab separation. So it's really lucky, but that's, I guess, comes from a lot of knowledge and help by professionals to get everything nice and feeling like myself again.
Absolutely. Plus, like, you have like a really like strong kind of background with Pilates, which like definitely like exercise really helps these things, and making sure that your body is strong not only in that area but everywhere else can help your recovery as well. So there's lots of amazing benefits of being really active before pregnancy, during pregnancy, and afterwards in terms of helping the recovery itself.
Yeah, because we both know afterward is actually the hardest.
The hardest.
Just one last question from me. It might be a bit out of left field, but what is the role that the pelvic floor plays in conception? We've spoken a lot about postpartum and pregnancy, but what is there a role pre-baby?
Other than like, I suppose from a conception thing, most of the time, if the pelvic floor is coming up, it's generally because people aren't able to have penetration, because the pelvic floor is so tight that it's creating a pain on initial penetration, and that people can't fall pregnant naturally, I suppose, because they're unable to have intercourse from a penetrative perspective. So that would be the most like probably common time for the pelvic floor to play into fertility. Otherwise, it's generally like from a conception perspective, making sure that you can enjoy your journey as much as possible. So treating any kind of sexual pain with like penetration, arousal, or orgasm. Otherwise, it generally doesn't have, like, I wouldn't say there'd be any other kind of research to say that it would have any negative consequences at that point. But it is a great time to start thinking about your pelvic floor more, particularly if you're thinking about pregnancy.
Yeah, awesome. Thank you.
Last one before we move into our acronym. We started talking about some specific equipment postpartum that can help with recovery. Was there any other suggestions that you had even during pregnancy? Because it can be quite straining on the body.
I mean, I think wearing something to support your tummy in pregnancy can be really helpful to take a little bit of pressure off. A lot of people find that they just like naturally, particularly later stages of pregnancy, start to like hold their bump at the end of the day because they're tiring. So having something like, again, it could be like a tubey grip that's like a little bit bigger to allow stretch for a pregnant bump. It could be wearing active wear with a little bit of support. The general rule of thumb in pregnancy is you can have something on your tummy, but it can't feel restrictive, and you need to feel comfortable wearing it. Some people don't like having anything touch their tummy in pregnancy, and that's totally fine as well. But I think just making sure that you feel like you've got supportive clothes on if you need it can be really helpful. There's heaps of types of belly bands. There's SIJ belts if you've got pelvic pain. There's singlets that have inbuilt tummy support. There's the shorts, the leggings. There's all sorts of things. I think another one in pregnancy, I spoke about it on another podcast as well, is that like often like your bra size increases quite a bit in pregnancy. And I guess if you're exercising, it's another thing to consider is making sure that you've got a good fitting bra. And if you can't find one, for those in Melbourne, there's like a great clinic called She Science that actually fits sports bras for exercise, which is really good for like pregnancy and like breastfeeding and postpartum. So that's probably like the other biggest one I would say. And then like postnatal, again, it's just like making sure you feel like you've got the support you need. Having the compression is the biggest thing.
All right, we're going to jump into the last segment of the podcast. Thank you. We could talk to you all day.
Sorry, I feel like I'm such a chatterbox.
No, we love it. Energy. All right. So Nava represents the core values we explore in our podcast, and each letter of Nava stands for an essential aspect of personal and professional growth. And we always start with N for navigate. Can you please share a time you had to readjust your goals due to the demands of motherhood, and how did you handle it?
I feel like this is an everyday thing for me at the moment. You guys might find this as well, but I suppose like when you've got different hats on your head, like the business hat, your own personal hat, and then your motherhood hat, it's really hard to kind of like divide yourself between them. And a lot of the time I feel like I just blend across all of them and like don't do a good job in like any department. And that's, I think, probably the mum guilt comes out again with that. But I guess that's something I'm really trying to work on at the moment and navigate how I can have like my business hat on and just focus on that at certain times. And then the times that I'm with Izzy on like my meant to be days off, how can I just have my mum hat on for those days to separate things? I haven't been great at it recently, or probably actually the whole time I've had Izzy, it's blended a lot. And I suppose the longer that goes on for, you feel like from, I suppose, your own like mental health starts to suffer when you can't do things well. And, you know, I don't know, I suppose like particularly from a business perspective that requires so much attention, particularly having staff there as well. You want to be there for them, that things start to like not work out as well for you when you're blending them all. And so I guess like I don't have an answer of like how to do it, but I'm in the thick of it trying to work it out.
Thank you for being honest. I think that's a really great word that you said, blending. And I don't feel like you can take one off and put another one on. There's always something on in the background, in whether you're a mum or not. Like, yeah.
Yeah. You can't switch the other things off. Like it's always there to some degree. Yeah.
Yeah. So A is for aspire. What advice would you give to mothers who are hesitant to pursue their dreams due to the responsibilities of parenting?
I think that there's probably very similar to like your journey to becoming a parent. Like you never feel like there's a really good time to throw yourself into the thick of it. And I feel like with a business, it's very much the same. I feel like you'll never be able to kind of line things up perfectly to be like, this is the best time for me to do it. There's always going to be things that require your attention that are outside of the business. And so I think if you're like wanting to do something, you just have to go head first into it, and maybe being like a little bit naive is good because it will kind of like push you to do it. Sometimes when you like feel like you look into it too much and you weigh up the pros and the cons, like you get more scared about it. But I think that you'll always make it work, whatever you decide to do, and throwing yourself into it and just seeing how you go and just making the best of whatever moment you can at whatever time of life that is. It would be worth doing because it's incredibly rewarding when you're doing something that's for yourself and it's your own passion as well, that you'll always make it work.
Love that. All right. The next one is V for value. Obviously, your little Izzy is under 2, but I feel like kids are impressionable from as soon as they're born, basically. How do you teach or plan to teach is and any children you have in the future the importance of self-worth and taking care of yourself?
I think probably just trying to have like really open and honest conversations about like emotions, I suppose, would be one. Probably like myself not being too critical of myself in front of her would be another one. I don't know. It's like such a tough one, isn't it? Because I feel like we like grew up in such a different generation compared to like what our kids are growing up with social media, that I like the thing that comes to mind when you ask me this the most is more, there was this research done, it was by Dove actually, and they interviewed kids that were under 5 about what they don't like about their body, and they asked their mums the same question, and the kids that were under 5 had the exact same answers as their mum, and like totally different body types and stuff. And I think that like since having Izzy, that's like always on the front of my mind about like self-worth and trying to like really just like be kind to myself and like not look in the mirror and only take one picture, and not let her like start to be self-critical in any kind of way, and just like be happy with who she is. And yeah, I don't know why that stuck with me so much. I think it was like the Pretty Foundation or something. I saw the statistics, but it just like scared me so much that that's like what kids are picking up on at such a young age, and probably the technology doesn't help either.
Yeah, it almost makes me want to cry. Like, it's really sad. And I think because we came from a generation where we had terrible magazines telling us all sorts of things, and it's really hard, and how traumatic that it was to us. And then you think about social media now, like how we can try and negate some of that for our children. Yeah.
Hopefully it's banned by the time our kids go to school.
Hopefully.
It's such a interesting thing though, what you said, that you're like, in front of, and I feel like a lot of parents would be the same, like in front of the child, you try to like,
I know, how bad is that?
No, but I think that's so real. I feel like, you can't help the inner critic or the inner self-talk. But it's definitely a good reminder to be like, you know what, I'm doing my best and I'm going to honor that. Yeah.
Absolutely. But you're right, though. Probably should be trying to break those habits all round, though. So
you can't do it all.
All right. Last one is A for achieve. As a mother and business owner, what actions have you taken to achieve your goals in both areas?
I think that it's like, that's like definitely like an ongoing thing for me. I think with like the business, there are always like goals to reach more people, you spread more awareness and educate people from a pelvic health perspective, with like, accessible information that people like can hopefully afford. And so I feel like we're always kind of shifting our goals to try and like achieve that moving forward. And then I guess from like a motherhood perspective, just trying to be like as present as possible with Izzy when I am with her is like definitely like a goal that I'm trying to achieve at the moment, to just like really soak it in and enjoy and like help with her development. But yeah, it's an ongoing process as well. So we'll let you know how it goes.
No, well, you're doing amazing. Thank you so much for coming on and sharing all your knowledge and expertise with us and our listeners. I've learned so much, and I'm sure so many will benefit from listening to you today.
Thank you so much for having me. It was great to chat.
That's a wrap for this episode. If you enjoyed this conversation, please subscribe, rate, and leave a review.
And remember, you can always find more episodes and updates on our website and social media page. You can find us on Instagram at nava.podcast. Until next time,
keep chasing your dreams and making your mark on the world.